Welcome to the dvm365. Give us 5 minutes, we'll give you the veterinary news, medicine, and business information you need to know right now. I'm Business and Team Channel Director Brendan Howard. In this special edition of the dvm365, live from CVC Kansas City, we'll hear from Steve Dale, Ernie Ward, and Fritz Wood. But first up, the news from Kristi Reimer, dvm360 News Channel Director.
While concerns of human West Nile virus make headlines, incidence of equine West Nile virus is rising as well. About 80 cases have been confirmed so far this year, and the number is steadily rising, with Louisiana topping the list at 21 cases. Equine West Nile virus, which is transmitted by mosquitoes, has a mortality rate of up to 40% in horses. Experts are urging horse owners to make sure their horses are vaccinated. A veterinarian in Gainesville, Florida, is running for U.S. Congress. Dr. Ted Yoho, who upset 12-term incumbent Cliff Stearns in the Republican primary, has practiced large animal medicine for 29 years and says he'll use his experience as a diagnostician to create an effective treatment plan for Congress, and especially to help small business owners like his fellow veterinarians. This is Kristi Reimer from CVC Kansas City.
Integrating behavior at your general practice can be difficult, but pet personality, writer, and CVC speaker Steve Dale told us the #1 question you can use with clients to get started.
When your client comes in to see you, what's the first question you ask? Well, how's the weather and how are your kids? I mean, the kids with 2 legs. Whatever you want to ask about the clients, all of that is fine. But when it comes to the pet, have there been any changes in your pet's behavior? First of all, that's a clue that something physically might be going on. But secondly, isn't that who you want your client to talk to about a behavior issue? You need to be the resource for that for a whole lot of reasons. First, you can do the most help. You can offer information rather than so much misinformation that's out there. And so many behavior issues aren't only behavior issues, it's kind of woven in with what might be a physical issue. So that is the most important thing to ask. And in fact, you might not only be saving a client, you might be saving a life, because it could well be that we know for young dogs and cats, more die because they're relinquished to shelters for behavior issues than any other reason. It matters.
Coming up, veterinary financial consultant Fritz Wood explains one way you can deal with clients who are complaining about the cost of their medications. But first, Dr. Ernie Ward explains the key to making yours a positive practice.
It's your attitude. You control your attitude each day. Remember, you can only hold one thought in your mind at any instant, so make it a positive one. I mean, you make that choice every second, every instant of your life. Are you having a happy thought? Are you having a negative or angry thought? And I know this is easier said than done, but the reality is, as soon as you understand you have control over your emotional state, you can direct your thoughts, then you begin to, in the words of Earl Nightingale, ordain your destiny. So for me, the most important thing you can do is have that positive attitude. How do I do that, though, on a real recipe level? Staff training once a week. We get to clear the air. We get to talk about issues that might be challenging our team. We get to share peer-to-peer motivation and celebrate those successes and wins that we all need to remind us that we are doing something important and meaningful. So for me, the most important thing you can do is keep that positive attitude above all else. Make your thoughts positive ones, and then maybe once a week, reconnect, reignite that enthusiasm for practice.
Hi, I'm Dr. Mike Paul, and you're watching the dvm365.
The cost to prevent is significantly less than the cost to treat. And I'll just use heartworm as an example. The cost to prevent heartworm disease is probably 10 times cheaper than the cost to treat heartworm disease. So I think if we reframe it that way, acknowledge their concern about the cost, acknowledge the fact that all pharmaceuticals are constantly on the upward trend in price, human and veterinary, and then reframe it, perhaps in a cost per day, and a cost to prevent versus a cost to treat.
And that's it for this edition of The Five, live from Kansas City. We hope you enjoyed it. If you have any questions, comments, or suggestions for us, please email us at dvm360@advancedstar.com. And for all your veterinary news, medicine, and business information needs, please come to dvm360.com every day.